Welcome to today's deep dive. We're going to be looking at a recent veterinary neurology research article, and it explores the potential of dynamic contrast enhanced MRI, or DCE-MRI, in differentiating canine brain tumors.
Yeah, this is a fascinating area of study, especially for those of us interested in non-invasive diagnostic techniques.
Yeah, for sure. The study specifically, looks at whether DCE-MRI can accurately distinguish meningiomas from other types of brain tumors in dogs, which is crucial for prognosis and treatment.
Precisely. And it's a very welcome advancement, considering the challenges and risks associated with current diagnostic methods, like brain biopsies.
Right. So let's start with a little background. We know that brain tumors are unfortunately common in older dogs.
Yeah.
And meningiomas are the most prevalent type.
Right, and meningiomas tend to be more treatable compared to other tumor types, like histiocytic sarcoma or glial cell tumors, but accurate differentiation is still critical.
Yeah. So how does DCE-MRI work? It sounds pretty complex.
Well, it involves injecting a contrast agent into the dog's bloodstream and then rapidly taking a series of MRI images. The images track how the contrast agent moves from the blood vessels into the tumor tissue, providing insights into tumor blood flow and vessel permeability.
Interesting. So essentially, we're visualizing the dynamics of blood flow within the tumor itself.
Exactly. And these dynamics can differ significantly between tumor types, allowing us to potentially differentiate them based on these DCE-MRI parameters.
Okay. The study we're discussing had a specific design. Can you elaborate on that?
Sure. It was a retrospective study, meaning they analyzed data from dogs who had already undergone both DCE-MRI and subsequent surgical confirmation of their tumor type.
Okay. And what was the sample size like?
They included 6 dogs with confirmed meningiomas and 3 dogs with other types of brain tumors.
Okay. So a relatively small sample size.
Right.
And what specific parameters did they focus on during the DCE-MRI analysis?
They measured 2 key parameters: Ktrans, which reflects vessel permeability, and cerebral blood flow, or RBF. These values were then compared between meningiomas and the other brain tumor types.
So essentially, they were looking for differences in these parameters that could help distinguish meningiomas.
Precisely. And they also compared these values to measurements from normal brain tissue to further establish the unique characteristics of meningiomas.
And what were some of the key findings that emerged from their analysis?
Well, the most striking finding was that meningiomas exhibited significantly higher RBF compared to other tumor types. This suggests that DCE-MRI could indeed be a reliable way to distinguish meningiomas based on their greater blood supply.
That's certainly promising. And what about Ktrans? Did that parameter show any significant differences?
Ktrans values were also higher in meningiomas. The difference wasn't statistically significant in this study. However, they did find that both Ktrans and RBF values were significantly higher in meningiomas compared to normal brain tissue, confirming their highly vascular nature.
Interesting. So RBF seems to be the more prominent differentiator in this particular study.
Yes, at least based on this initial data.
What about the relationship between tumor volume and these parameters? Did they find any correlation?
That's a great question, and surprisingly, no. They found no correlation between tumor volume and Ktrans, suggesting that permeability is not affected by tumor size in meningiomas.
So even small meningiomas could potentially be identified through DCE-MRI based on their distinct RBF.
Potentially, yes. However, it's crucial to remember the limitations of this study, particularly the small sample size, which makes it difficult to draw definitive conclusions.
Right. Larger studies are definitely needed to validate these findings. What other limitations did the researchers acknowledge?
They mentioned some challenges in obtaining reliable arterial input function values for all the dogs, which is a technical aspect important for accurate analysis.
Okay. Despite these limitations, the study's findings are still quite compelling, paving the way for future research in this area.
Absolutely. And it highlights the potential of DCE-MRI as a valuable tool for non-invasive diagnosis of canine brain tumors, which could significantly impact how we approach these cases in clinical practice.
Yeah. That's the burning question, isn't it? How will this research translate into real-world applications?
Indeed. And that's what we'll explore further as we delve deeper into the study specifics and discuss its implications for the future of veterinary neurology.
Okay, great. Let's move on to the study's figures now. They're quite striking and offer a visual representation of the data.
Yeah, they do. And they can help us grasp the nuances of DCE-MRI and its potential in differentiating between different types of brain tumors.
So let's dive into those figures and see what insights we can glean.
Sounds good. Let's start with Figure 1, which shows a signal enhancement curve. This graph plots how the signal intensity changes over time after the contrast agent is injected. And you can see a clear distinction between the curve for the tumor region and the curve for normal brain tissue. The curve for the meningioma shows a much steeper and higher peak, indicating rapid uptake and washout of the contrast agent, while the curve for normal brain tissue is much flatter, indicating slower and less intense contrast enhancement.
Right, that's a great visual representation of the higher vascularity we've been discussing.
Exactly, and if we look at figures 2 through 5, they showcase individual cases. Dogs with different types of brain tumors, you can visually see the differences in Ktrans and RBF maps overlaid on the traditional MRI images. For instance, in figure 2, you see a dog with a meningioma, and the RBF map is just ablaze with color, indicating high blood flow. Whereas in figure 3, which shows a dog with histiocytic sarcoma, the RBF map is much less intense.
Wow, that's a stark visual contrast. It really drives home the point about the high vascularity of meningiomas.
It does. These figures provide a powerful visual complement to the statistical data, making the research more tangible and easier to grasp.
I agree. It's one thing to talk about numbers and statistics, but seeing these visual representations really brings the research to life.
Exactly, and it underscores the potential of DCE-MRI to provide valuable diagnostic information that can guide our clinical decisions.
Now, I know we've touched upon the statistical analysis briefly, but I think it's worth delving a bit deeper into that aspect. Can you elaborate on the specific statistical tests they used and what they revealed?
Sure. They employed several different tests. For instance, they used the Wilcoxon matched paired signed ranks test to compare the Ktrans and RBF values between the tumor region and normal brain tissue in the meningioma group.
Okay, and what did that test tell us?
It revealed a statistically significant difference, meaning that both Ktrans and RBF were significantly higher in the meningiomas compared to normal brain tissue, further supporting the notion that DCE-MRI can differentiate meningiomas based on these parameters.
Interesting. What other statistical tests did they conduct?
They also performed a Mann-Whitney-U test to compare the Ktrans and RBF values between the meningioma group and the group of dogs with other brain tumors. This test is used to compare two independent groups, and it revealed statistically higher RBF in the meningioma group, but the difference in Ktrans values, while higher in meningiomas, did not reach statistical significance.
So again, RBS appears to be the more reliable marker for differentiating meningiomas, at least based on this study.
That seems to be the case. However, it's important to remember that the small sample size limits the statistical power of these findings.
Of course, and they did acknowledge that in the paper. They emphasized the need for larger studies to confirm their observations.
Absolutely. And to explore the role of Ktrans more thoroughly, it's possible that with a larger sample size, the difference in Ktrans values might reach statistical significance.
Right. So it's still early days in this research, but the initial results are certainly promising.
They are, and they open up a whole new avenue of exploration in veterinary neurology.
So where do we go from here? What are some of the next steps in exploring the potential of DCE-MRI for diagnosing canine brain tumors?
Well, the most pressing need is for larger, multi-center studies to validate these findings and establish clear guidelines for using DCE-MRI in different clinical scenarios.
Right. We need more robust evidence to support wider adoption of this technique.
Precisely. And we also need to address the issue of accessibility. DCE-MRI requires specialized equipment and expertise, which may not be readily available in all veterinary practices, particularly those in smaller towns or rural areas.
That's a valid concern. Bridging that gap will be crucial for ensuring equitable access to this advanced diagnostic tool.
Absolutely. And finally, we need to consider the cost factor. DCE-MRI can be an expensive procedure, which may pose a barrier for some pet owners.
That's true. Finding ways to make this technology more affordable without compromising quality will be essential.
However, despite these challenges, I remain optimistic about the future of DCE-MRI in veterinary neurology. The potential benefits are undeniable, and I believe that with continued research, innovation, and collaboration, we can overcome these hurdles and make this technology a standard part of our diagnostic toolkit.
Well said. I share your optimism. This study has ignited a spark, and I'm excited to see how it shapes the future of veterinary diagnostics and patient care.
Me too. It's an exciting time to be in this field, and I have no doubt that we'll continue to see remarkable advancements in the years to come.
Before we wrap up this deep dive, I want to leave our listeners with a thought-provoking question. We've discussed the potential of DCE-MRI to become a standard part of brain tumor diagnostics in dogs, but what about its applicability to other species?
That's a fascinating question, and one that warrants further exploration. We focused on canine brain tumors in this deep dive, but the principles of DCE-MRI could potentially be applied to other animals as well.
Imagine the possibilities if we could use this technique to diagnose and monitor brain tumors in cats, horses, or even exotic animals.
It would open up new avenues for veterinary neurology across different species, leading to more accurate diagnoses and more effective treatment strategies.
It's a reminder that the quest for knowledge and innovation knows no bounds, and the discoveries we make in one area can often have ripple effects across multiple fields.
Exactly. This research on canine brain tumors could potentially pave the way for advancements in veterinary neurology for a wide range of species.
And as we continue to push the boundaries of what's possible in veterinary medicine, we can strive to provide the best possible care for all creatures, great and small.
From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging. You know, one thing that really struck me about this study was their analysis of Ktrans. It didn't reach statistical significance in differentiating meningiomas from other tumor types, in this study at least. But I think it's a parameter worth keeping an eye on.
Yeah, I see what you mean. They did find significantly higher Ktrans in meningiomas compared to normal brain tissue, right?
Exactly. And while the lack of significance between meningiomas and other tumors could be due to the small sample size, it could also point to something more nuanced about the vascular characteristics of different tumor types.
But it's not just about how much blood flow there is, but also about how leaky the blood vessels within the tumor are.
Precisely. And that level of leakiness or permeability can be influenced by a variety of factors, including the tumor's microenvironment, the types of cells present, and even the dog's overall health status.
That raises an important question. Could Ktrans potentially become a more useful marker as our understanding of these tumors evolves and as DCE-MRI technology improves?
It's certainly a possibility, and this study lays the groundwork for that kind of investigation. They've shown that DCE-MRI can capture these subtle differences in vessel permeability, which could be incredibly valuable as we move towards more personalized medicine and veterinary neurology.
It's like we're getting a glimpse into the tumor's personality, so to speak, beyond just its size and location.
I like that analogy. And the more we understand about those individual tumor personalities, the better equipped we'll be to tailor our treatment approaches for each patient.
Speaking of treatment, I'm curious about how DCE-MRI could impact the way we manage these cases in clinical practice. You've mentioned the possibility of avoiding biopsies in some cases.
That's right. If we can reliably differentiate meningiomas from other tumor types using DCE-MRI, it could potentially spare some dogs from undergoing a biopsy, which, as you know, is an invasive procedure with inherent risks.
And it would also allow for earlier intervention. If we're more confident in the diagnosis, we can start treatment sooner, which could improve outcomes, especially for those dogs with more aggressive tumor types.
Exactly. And DCE-MRI could also play a crucial role in monitoring treatment response. By tracking changes in RBF and Ktrans over time, we could gain insights into how the tumor is responding to therapy.
So it's not just a one-time diagnostic tool, but potentially a valuable tool for ongoing management as well.
Absolutely. It could help us assess whether a particular treatment is working, whether we need to adjust the dosage or change therapies altogether, and ultimately, whether the tumor is shrinking or progressing.
This study has really opened my eyes to the possibilities of DCE-MRI. In veterinary neurology, it feels like we're on the cusp of a significant shift in how we approach brain tumors in dogs.
I agree. And it's not just limited to dogs. The principles of DCE-MRI can be applied to other species as well, potentially revolutionizing how we diagnose and manage brain tumors in a wide range of animals.
That's a really exciting thought. It's a reminder that the pursuit of knowledge and innovation in one species can often benefit others, leading to advancements across the entire field of veterinary medicine.
Exactly. This study is a perfect example of that. And it highlights the importance of collaboration and open communication within the veterinary community. By sharing our knowledge and experiences, we can all learn from each other and ultimately improve the lives of our patients.
Well said. And it's that spirit of collaboration that will drive the field forward and lead to even more groundbreaking discoveries in the future.
Now, as promising as this study is, it's important to remember that DCE-MRI is still a relatively new technology. In veterinary medicine, there are still many questions that need to be answered, challenges that need to be addressed, and research that needs to be done.
Absolutely. The researchers themselves acknowledge the limitations of their study, particularly the small sample size. Larger multi-center studies are crucial to validate these findings. and establish clear guidelines for using DCE-MRI in different clinical scenarios.
That's the crux of the matter. We need more robust evidence to support wider adoption of this technique. And we also need to address the issue of accessibility. Not all veterinary practices have the resources or expertise to offer DCE-MRI, especially those in smaller towns or rural areas.
That's a valid point. Bridging that gap
Yeah.
and ensuring equitable access to this advanced diagnostic tool will be essential as we move forward.
Precisely. And then there's the cost factor to consider. DCE-MRI can be an expensive procedure, which may pose a barrier for some pet owners.
It's true. Finding ways to make this technology more affordable without compromising quality will be crucial for ensuring that all animals have access to the best possible care.
But even with these challenges, I remain optimistic about the future of DCE-MRI. In veterinary neurology, the potential benefits are simply too great to ignore. And I believe that with continued research, innovation, and collaboration, we can overcome these hurdles and make this technology a standard part of our diagnostic toolkit.
I share your optimism. This study has sparked a lot of excitement in the field, and I'm eager to see how it shapes the future of veterinary neurology and improves the lives of our patients.
Yeah, it really is remarkable to think about how far veterinary neurology has come, even in such a short time. DCE-MRI is a great example of how technological advancements are, pushing the boundaries of what we thought was even possible, allowing us to see inside the brain with such detail, something we couldn't even imagine just a few years ago. It really is revolutionizing how we diagnose and manage brain tumors in our patients. And as technology continues to evolve, I have no doubt that we'll see even more incredible advancements in the future.
And it's fascinating because it isn't just about improving diagnostics, but also about improving patient outcomes by being able to differentiate tumor types accurately and to monitor that treatment response. Personalizing our treatment strategies, we can offer patients the best chance at recovery.
That's the ultimate goal for any veterinary neurologist, right? To provide our patients with the best care, the most effective and compassionate care possible. And DCE-MRI is a very powerful tool that can help us achieve that goal.
As we wrap up our deep dive into this research, I want to touch on one more thing I think is really relevant for those of us in clinical practice. The authors highlighted the need for standardized protocols for DCE-MRI in veterinary neurology.
That's a good point. With any new technology, it's important to establish clear guidelines for its use to ensure consistency and reliability across different practices and institutions.
Yeah, it makes sense. We need to be able to compare, apples to apples. When we evaluate DCE-MRI results, standardized protocols for image acquisition, analysis, and interpretation will be critical for ensuring that we're all on the same page and drawing the right conclusions from the data.
For sure. And these protocols should be tailored to the different tumor types and species. A meningioma in a dog may have different vascular characteristics than a glioma in a cat, for example.
That's a great point. It really shows the need for ongoing research and collaboration within the veterinary neurology community. We need to share our experiences, refine techniques, and really develop those best practices to ensure that DCE-MRI is being used to its full potential.
And that collaborative spirit is already out there. There are tons of research groups all over the world actively investigating these applications of DCE-MRI in vet neurology. And I think we'll see even more progress in the coming years.
It's a very exciting time to be a veterinary neurologist. We are at the forefront of a new era in diagnostics and treatment. It's inspiring to see how our understanding of the brain and our ability to treat these neurological conditions continues to grow.
It's all driven by a shared passion for making life better for our patients, whether it's a family dog, a prize-winning racehorse, or an exotic animal. We are united by this common goal to provide the highest quality of care.
Well said. As we explore the possibilities of DCE-MRI and all these new technologies coming out, I'm confident that the future of veterinary neurology is bright, filled with new discoveries and breakthroughs that will benefit so many animals.
From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.